All right. So my presentation is on barbiturate versus benzodiazepine therapy in patients suffering from alcohol withdrawal syndrome. So alcohol withdrawal syndrome is the when daily consumption of alcohol leads to a physical dependence. So this is typically done after 7 days of straight of consuming alcohol. Your body begins to build a dependence for it. So now here on the picture, we you can see down here from the moment the last drink, there's an 8 hour gap between the first stage of alcohol withdrawal. And as you can see there, the signs and symptoms of the first stage are anxiety, insomnia, nausea, and abdominal pain. The second stage of alcohol withdrawal symptoms typically occurs up to 72 hours after the first drink. You're going to see increase in blood pressure, increase in body temp, an increase in the anxiety, an increase in the nausea and vomiting. The patient might be delirious, having hallucinations, which is also part of stage three. Um, Sweating profusely, a lot of forehead sweat. Um, and all these signs of being agitated, being confused, hallucinations all fall into that. And going into stage three, if left untreated, the patient can have hallucinations, fever, seizures, agitations, whoops. And most patients will not realize that they're having these withdrawals until they're having a seizure. They'll come in, treat them for a seizure, and treat them for alcohol withdrawal syndrome and get them out of there. So there's an indicated study and a gap in the literature that indicates barbiturate therapy could be used as an alternative or an adjunct therapy for alcohol withdrawal syndrome. The studies suggested that patients treated with barbiturates versus benzodiazepines did show an improvement in length of withdrawal times, adverse effect in ICU admissions. One of the studies also indicated that the length of stay was also decreased in patients who did have an alcohol induced disease process when treated with barbiturate therapy for alcohol withdrawal syndrome. However, this study is not including patients that have an alcohol induced disease process, such as alcohol induced cirrhosis or alcohol induced pancreatitis, and any of those disease processes along the way, such as, varices, esophageal varices, things like of that nature. So the PICO for this study, the patient population is patients suffering from alcohol withdrawal. The intervention that we're going to be using is the use of barbiturate medications, either as an independent therapy or as an adjunct therapy with benzodiazepines. The comparison of the study is the use of benzodiazepine medication therapy, and the expected outcome of this project is there's going to be a reduction in time of withdrawal when using benzodiazepines, a decrease in ICU admissions when using barbiturates versus benzodiazepines for high scoring patients, and a decrease in adverse effects related to medication therapy. So the purpose and root cause of this study, the overall purpose we want to do is, really just improve quality of care for patients. So we want to decrease the withdrawal times, decrease adverse effects related to the medication therapy, decrease ICU admissions with an overall goal of implementing barbiturates or phenobarbital as either a replacement or as an adjunct therapy for AWS to improve the outcomes for these patients who suffer from alcohol withdrawal syndrome. So again, the root cause and the purpose are generally the same. The root cause of this study includes length of withdrawal, for which the average length of withdrawal times will be compared for both barbiturates and benzodiazepine patients. So patient will come in, they will get a scored, say they're scoring 18 on the CYAR scale, which we will discuss in the future. The CYAR scale, they'll score an 18. They will be given barbiturates, and another patient who scores an 18 will be given benzodiazepines. Comparing these two patients, that we want to look at the length of withdrawal time that it took. So from the moment that patient scored an 18 to the moment the patient scores a 0 consistently. So the patient wants to score 0 twice, and then we're going to take that as length of withdrawal. We also want to identify the total number of alcohol withdrawal patients are going to be admitted to the ICU. So if the patient is scoring high, there's a risk for airway impedance. They need to be vented. They need to be sent to the ICU for any reason. We want to know whether treated with benzos or with barbiturates, and which patient population had the most patients admitted to the ICU during the time of the study. Adverse effects of pharmacological therapy related to benzodiazepines, sedation, respiratory distress. That's going to be examined by nurses and clinical staff and documented throughout the procedures of this study. So the methods of the study, we're going to obtain patients with a convenient sampling plan. So whoever happens to come into our facility, we're going to implement the use of phenobarbital or another choice of barbiturate for this study, phenobarbital. We want to document and treat patients that were used with phenobarbital. We're going to implement a measurement plan that aims to reduce withdrawal times, ICU admissions, and adverse effects of drug therapy. And this study will exclude patients who have been diagnosed with an alcohol-induced disease process. And once again, that's such as liver cirrhosis or pancreatitis related to alcohol abuse. So the expected results of this study, we're expecting a decrease in ICU admissions and ICU length of stay for patients suffering from alcohol withdrawal. This means we want to see a total decrease in ICU admissions for patients with alcohol withdrawal and a decrease in the length of ICU stay being treated with phenobarbital if they are admitted to the ICU. We want to have a decrease in effects related to drug therapy, such as respiratory depression. So we want to monitor, are patients more likely to have these adverse effects when treated with barbiturates or treated with benzodiazepines, and document the adverse effects as they come up through the EMR. And obviously an overall decrease in length of withdrawal time. So, we'd rather see them have, a 4-day withdrawal rather than a 6-day withdrawal. We want to see if phenobarbital or barbiturate therapy does indeed help that process. So that CWA-AR scaling system is what is typically used to score patients based on the level and stage of alcohol withdrawal that they are in. Based on the score, the patient is given a set amount of benzodiazepine or barbiturate medication, typically Ativan, in this case phenobarbital for our study. The Ativan or the phenobarbital, Ativan being the benzodiazepine, will be given to the patient to calm them down, sedate them, and ease the alcohol withdrawal experience and get them through that. So obviously, high scoring patients with airway distress, anything along those lines, need to be admitted. They will be sent to the ICU. This study bases time of withdrawal based on the CWA-AR scoring, meaning that the patient comes in and they are scoring. We're starting that as length of withdrawal to the moment the patient scores 0. If they score 0 after the first initial scoring of 0, then that would be the end of the withdrawal. If the patient scores again after scoring 0, we're going to continue that within the withdrawal. The patient must score 2 zeros twice in order for that to be considered the end of the withdrawal for this specific study. And once the patient scores 0, the time of withdrawal will have ended, and the overall information from the study will be collected from the EMR. So this information will be seen by the clinical staff and by the study staff. So clinical recommendations for the study that we're going to implement: patients treated for only alcohol withdrawal syndrome should be given barbiturates as an alternative or adjunct therapy. So that meaning if a patient comes in with alcohol withdrawal syndrome and a secondary diagnosis of, COPD, heart failure, anything along that, they will not be included in the study. Patients coming in must only be treated for alcohol withdrawal syndrome. No secondary diagnosis, including alcohol-related diseases. Clinical nurses are responsible for the administration of medications and scoring of these patients. So the clinical nursing staff will score the patient in the EMR so the staff can see it, and then we'll give medication based on the orders or the medications that would be given, in our case phenobarbital and or Ativan if that patient's does need that therapy. Patients with the secondary diagnosis of alcohol-induced disease process will be excluded. We've already covered that. And the study will exclude ICU admissions not related to alcohol withdrawal syndrome. So if the patient not with an alcohol withdrawal syndrome, we're not going to include them. If the patient comes in with alcohol withdrawal syndrome and a secondary diagnosis of heart failure and they are admitted to the ICU with an exacerbation of heart failure, that patient will not be included in the study any longer. These are the references, and that is that, ladies and gentlemen. Thank you very much.